So when we think about scaling the challenge we've been wrestling with, it's essentially a pretty simple problem in some ways, that you've got an organization or a network, and it's got a center or a pocket of excellence, and how do you spread it from those who have it to those who need it without screwing up? Or to quote Pete Seeger, the famous folk singer, these are situations where the only thing that's wrong with it, or the main thing that's wrong with it, is there isn't enough of it. So that's the challenge we've been looking at. And we have the privilege of being at Stanford, so we have a long time to think about it, since we don't have real deadlines like many people in this room. So our core message, we kind of think about our core message, is that successful scaling isn't just about creating the biggest possible footprint you can, it's about spreading a mindset. And when we look at cases, especially of relatively fast, it's always slower than it looks, but still relatively fast and successful scaling, they almost always take time to really instill the mindset among the people who in the places where they're scaling to. A good example some of you may know about is Bridge International Academies, which is a for-profit sort of Starbucksization, they use this term, of schools for very poor kids in Africa. The parents pay about $5 a month tuition, yet it's a for-profit model. They were started in Nairobi, one school in 2009. Now they've got 215 schools. I just talked to Shannon May, who's one of the founders, 65,000 students. And one of the reasons they've been able to scale so fast is they focus so much on instilling their mindset, their practices. They call it this academy in the box, incredibly standardized education that focuses on time on task, a lot of technology involved in it, and so that's why they've been scaling so fast and so effectively. So just to give you sort of a taste for some of the things that we think that are most important for, if you will, spreading a mindset and not just a footprint, let me start out with one of our first lessons. So as I said, perhaps because we had too much time on our hands, we spent at one point, I think, a good year making a longer and longer list of all the decisions that are important in scaling. But once we started writing and looking at cases and looking at academic evidence, we kept coming back to the same problem over and over again. And we call this the Buddhism-Catholicism continuum. Sometimes it's called the replication or local customization continuum. But essentially, organizations are always trying to find the right place in this continuum. To give you a quick example, Home Depot sort of took a Catholic model to China and tried to just install American-style stores in China where it was a do-it-yourself model. It did not work. They've left. 12 stores were closed. IKEA, much more successful. They figured out it was a do-it-for-me culture. They especially focused on delivery, and that nasty assembly stuff is stuff that's done for you because it's a do-it-for-me culture. But there's always, when it comes to spreading excellence, figuring out how standardized versus how much we're going to allow for local customization is a day-by-day decision. It's just not a big strategic decision. The second one is that scaling is a problem of more or less, more and less, not just a problem of more. As you spread a program or as an organization gets larger, there's always the need to shed sort of what got you here isn't going to get you to the next step. One organization, many of you know, they've actually got a .org now. IDEO, I've been tracking them for years. I used to go to Monday morning meetings at IDEO when there was 45 or 50 people. David Kelly, the CEO, was masterful at orchestrating them. That worked great. They got to 100 people, it was impossible. They had to divide things up. And it took us about a year to figure out that this just wasn't working. So that's kind of a second scaling lesson. Our third one has to do with the kind of culture that scales excellence. When you've got somebody at the top just always telling you what to do, but people throughout the organization aren't putting pressure on one another to do it right, excellence tends not to spread. So we have this quote that you create organizations where I own the place and it owns me. If you look at, there's some interesting research on the difference between regular hospitals when it comes to organ donation. Typically about when there's an organ donor who's both viable and has agreed to do it, most hospitals hit about the 50% level. When you look at the really great ones, about 15% of US hospitals that have a 75% or more organ donation rate, essentially everybody's working the problem, not just the doctors and the nurses, but the clergy, the receptionists, everybody is putting pressure on one another to make sure that the right thing is done and it's handled in the right way. So this is something we see that's, again, crucial to sort of spreading a mindset. The fourth thing, and this is a problem, that as organizations or programs get bigger, they put more cognitive load on people because more complexity is inevitable. Yet we human beings can only stand so much cognitive load. It makes us stupid. It makes us do the wrong thing. No matter how smart you are, you're probably really bad at multitasking. There's a lot of evidence for that. And just to show you a little example, you can't read this, and I'm not going to take time to read it. This was Intuit's attempt to spread essentially design thinking, originally put together by two of the smartest people I know, Scott Cook, one of the founders, and a Stanford PhD named Karin Hansen. They couldn't explain it to anybody. Nobody could understand it. This is what they scaled, so I don't think I have to explain that, just in the name of time. The other part I like to emphasize is people are always talking about simplicity. One of my friends, Gary Hamel, is always talking about tearing down bureaucracy and tearing down hierarchy. I believe in hierarchy and I believe in process. There's no way to run an organization of any size. The difference is sometimes there's good ones and sometimes there's bad ones. And organizations that say they want to be big, but be just like a little organization, it doesn't work. Ask Larry Page, when they got to about 400 folks, he decided he wanted to get rid of those middle managers because when they were little, they had no middle managers. At one point, there was over 200 people reporting to one senior person in engineering. This did not work. Now, Google, for those of you who know, Google has figured out that actually kind of the first line managers are probably one of the most important people to their success. A quick footnote, just in the name of time, if we were going to pick one main lesson that organizations screw up when they scale up, it's they start making teams too big. Once you get a team that's bigger than 6 or 7 people, it starts devoting too much time to coordination tasks. And also there's this problem. Think about if you go to dinner with 9 people versus 4 people, maintaining social relations is like a nightmare. So if you think you're having trouble with your team or you've got a lousy leader you're involved with, try cutting their team in half. The fifth one, a lot of times when scaling excellence programs start, what happens is there'll be sort of a kickoff conference that looks something like this, and they'll spray this thin coat of veneer, and somehow or another they'll expect that excellence has been spread. That doesn't work. It might get people interested initially, but when it really spreads, sort of what you saw with Nuru just a few minutes ago, there are deep pockets of excellence created, and then they're spread from where it is to where it isn't. And I really like the woman from Nuru, I can't remember her name, but she was sort of the local person who made this happen. Also, some of you may know that between 2004 and 2006, we had an amazing campaign in the US to stop preventable deaths in hospitals. It actually worked. You know, we always hear about things that don't work in healthcare. If you look at the numbers, a good 120,000 lives were saved. And the way this was really done was that units in hospitals that did good life-saving practices transferred them to ones that did bad and converted them. And we're talking about collaboration. This is a model where there was a small nonprofit called the Institute for Health Improvement, and they helped coordinate the process, but the collaboration happened on the ground. And I'll make my time more or less for my host. I tend to be time paranoid. Finally, this is my colleague Hagi Rao. This is his line. When it comes to spreading excellence, the first order of business is to get rid of the bad stuff, because bad behavior is so contagious, it's so powerful, it's so overwhelming. So our joke is it's not good to great, it's bad to great. So that's the first order of business when it comes to scaling. If you don't get rid of the bad behavior, it's very difficult for good things to spread. And then to wrap up, I'll skip this example in the name of time. I'd sort of offer you sort of 2 dangerous words if you hear them. We don't have time to do it the way we really should. When that happens, you do it 6 or 7 times badly. We see that over and over again. And finally, and it's really interesting if you look at the research on school reform. One of the signs when school reform works, there's some actually quite good quantitative studies. The reform efforts where people tend to take the path of most resistance rather than least resistance, where they sort of grind out and deal with all the different constituencies, take time to do it right, and just sort of end on this note, the notion that fast, easy scaling is possible, even when you talk to people at Facebook, at Google, where from the outside it looked like it was fast and easy, inside it was, frankly, they were doing the ground war rather than just the air war. So that's our story, and I think that I'll stop now because I'm over time, so thank you very much.